why has surgery, specifically implant surgery, has been able to create such opportunities, as I would put it. A decent sized family. I got three kids. They're all young, and my priority has always been to be able to be there for them. And being able to, perform these implant surgeries has freed up a lot of my time. I mean, I'm so busy in my practice to where I have two other associates that are, doing a lot of the more general dentistry, to where I'm afforded to be able to go out and teach, the majority of the week, right? I work 2 days, 2.5 days a week, and I'm able to do, other things that I find fulfilling, like, spending time with my family or going out and teaching other people how to do things like this, right? It's been extremely fulfilling. It makes my time more effective as well to be able to do implant surgery. That's part of the reason why I got into dentistry, right? Is to make sure and or basically be able to change lives, right? And some of the fastest way to do that is by giving someone something that they've lost. It's incredible that we've been able to, have this implant technology develop in just the last, 30, 40 years, right? It really, I mean, these types of implants have not been around significantly long compared to, the rest of dentistry, right? And so, I mean, even in just the last 10 years, we've had such great advances to be able to where we can take out somebody's entire set of teeth, put implants in, and have them smile, 8 hours later, right? Like it's quite incredible what dentists have been able to achieve. And things are just going to get better, particularly with robotics. When it comes to doing surgery, and you mentioned it being, consuming, you really have to think of it much more methodically instead of just shooting from the hip, right? And that's something that we do at Pathways is we teach you how to start from the very beginning, right? It's not, oh, there's bone, let's put an implant in there. It's okay, let's look at this from, a crown down technique. We're looking at the outcome first and then figuring out how to get there, right? We treat every case, very, very similar to where we make sure that certain checkpoints are done and we're making sure that we're able to get that predictability. It's a no-brainer to be able to have the way that pathways to set things up to where they take you and they give you these little baby steps, and you basically follow those baby steps. And yes, there's going to be deviations and different things that you have to do, but if you're able to go through that, it's something that's going to be predictable, right? And so you're not having to reinvent the wheel every single time you do a new surgical case. And when I was in the military, we obviously dealt with certain stresses, and being able to help these mentees for the first time that essentially have never placed an implant, never laid a flap, done things that they've never done before, and keep them feeling composed. We've all been there, right? We've never done something for the first time. We're really nervous. We're really afraid. Being that mentor, being in the room, providing that confidence is really important. I had an attendee today literally say, like, it didn't feel like you were overbearing while you're there. It felt like that you were providing that quiet confidence for me. You weren't there holding my hand, right? You were there when I needed you, and you were there to provide me that ability to say, "Hey, I can get through this." Because what we want to do is what we train you, and then next week you go place an implant, right? But we can't do that if we're literally holding your hand the entire way. We need you to be able to work through that process that we talked about to create that outcome. When it comes to the first actionable step to take, when it comes to, doing implants, is find someone that you can have that mentorship potential with, right? Find someone that willing to mentor you, whether that's your, your local specialist or a friend that you happen to know that graduated from dental school or whatever. Reach out to them and say, "Hey, I'm wanting to start doing this. What do you think about, having me, ask you a few questions about this stuff, really?" Because it's dentists, often find themselves trapped or lonely. And when it comes to surgery, I mean, you've got to know other people that have gone through stuff that you have, right? And so one of the important things that a lot of the mentors at Pathways is like, "Hey, here's our number. Like, if you've got a question when you go through a surgery, just let us know. If you need help with planning a case, no big deal. We'll talk with you about it." Because we want everyone to be successful. There's plenty of patients that need implants out there. And so we're just here to essentially help accelerate that and to be able to get you to where you want to be, right? And so there's always that fear, that first making that first step. But yeah, find somebody that's willing to be a mentor, or just someone that, is trying to go on the same pathway as you, that you can just bounce ideas off of, right? I'm sure you can find someone at an implant course that you get along with, and you guys can go down that journey together. what role did implantology create in creating my confidence and being able to, spend time with my family? I mean, it freed up a lot of time. I'm able to be more profitable per hour than doing, like fillings and crowns. Not that it's necessarily about the money for me, but it does create those freedoms, right? Like there's not many doctors that I know that they're able to work, 2.5 days a week and then, do whatever the heck they want the rest of the time. Most people have to work 4 or 5 days a week doing implants, doing, sedation, wisdom teeth, all this other stuff gives me the ability to work less. Now I'm working my butt off those 2.5 days, right? But it's really fulfilling work. And it also happens to be fairly profitable at the same time. And so that affords me to be able to, my kids are in school 4 days a week. And so on Fridays, I'm able to, hang out with them or I'm able to, come down to Pathways and share what I've learned.